and I'm Chris Geisnes, and this is a spinal protection and helmet removal teaching scenario. Participants will be expected to demonstrate removal of protective helmet, application of a correctly sized rigid cervical collar, log roll of a simulated trauma patient with a suspected spinal cord injury.
The use of personal protective equipment and standard precautions is highly recommended.
It is important for the emergency nurse to understand basic principles of spinal protection. Cervical collars alone do not immobilize the cervical spine. The entire torso must be immobilized and the backboard used as a splint to prevent flexion, extension, rotation, and lateral movement.
There are no contraindications to helmet removal. Any patient that has been injured wearing a protective helmet will need to have it removed in order to accurately and thoroughly assess the patient. For purposes of this teaching station, I will act as the team leader. Hello, my name is Andrew. I'm going to place my hand on your jaw to remind you not to move your head during this procedure. Are you able to wiggle your fingers and toes? I'm going to need an assistant to help me cut or remove these straps.
I can help. What can I do?
Would you please remove the strap from beneath the patient's chin? If you would then take your left hand and place it underneath her chin and your right hand underneath her occiput, it is important that you maintain inline stabilization throughout this procedure. I will now remove the helmet. I'm going to apply firm, gentle pressure in an outwards fashion while pulling in a longitudinal direction. Because this is a full face helmet, the helmet will need to be tipped upwards and backwards in order to clear the patient's nose. I will now assume control of the head. Would you please place an appropriately sized rigid cervical collar on this patient and then place a padded towel beneath her head to support the occiput.
A properly fitting collar will fit between the point of the chin and the suprasternal notch, resting on the clavicles and supporting the lower jaw. Always ensure that you follow the manufacturer's directions for correct application of the cervical collar.
Now that the collar has been applied, we will need 2 additional assistants to log roll the patient off of the backboard. Melody, if you would position your hand at her knees and hip, Chris at the patient's shoulder and hip. On the count of 3, we're going to log roll the patient to my left, ensuring that the spine remains straight without any twisting motion. I will ensure that the patient's nose remains in line with the umbilicus. 1, 2, 3. On the count of 3, we're going to return her to the supine position. 1, 2, 3. Can you wiggle your fingers and toes?
Yes, I can.
It is important that spinal protection be maintained until appropriate clinical clearance and diagnostic testing has been completed. This completes the spinal protection and helmet removal teaching station.